Hey everybody, and welcome to another episode of Accidental Isolation, where I like to bring on a guest to talk about a moment in their life where they may have been felt isolated, whether that be mentally, physically, or emotionally. The purpose of this podcast is to bring guests on and tell their story, so you'll be able to learn and possibly put tools in your toolbox from their life experiences. Today we have a very special guest, Dr. Chepke. I'll let him introduce himself and tell you a little bit about himself. So, how you doing?
I'm good, Chauncey. Good to be here with you.
Yes, sir. I appreciate it. First, I'd like to just thank you for the time. You're a very busy man, and I really appreciate you giving me a little bit of your time today. And hopefully the guests or the listeners will be able to gather a lot, from your life story.
You bet. My pleasure to be here, and I hope to give some tools as well to everybody out there.
Yes, sir. Appreciate it. All right, so we're going to go ahead and get started and just let the guests know just a little bit about you. Who are you? What are you? Obviously, I introduced you as Dr. Chepke, but what type of doctor are you?
Sure. So my name's Craig Chepke. I'm a psychiatrist, and I have a practice that I started along with my wife, who's a social worker, and we're in Huntersville, North Carolina.
Yes, sir. So tell us a little bit about where you're from, a little bit about your upbringing and things like that.
Sure. So Huntersville is a suburb of Charlotte, North Carolina, and I grew up in Charlotte.
Okay.
I was raised by my mom and my grandparents, and when you came into the office this morning, that was my mom at the front desk.
Yes,
She's
sir.
My secretary. So this is a true family business. Mentioned my wife works here as a social worker therapist, and my mom's the secretary. And any given day, you might see one or more of my kids in here. So we try to keep a family-based environment.
Yes, sir. Okay. So let's talk about you. Huntersville, North Carolina. Right. That's where you're born and raised. Do you have any siblings?
I don't. I was the only child of my mom, but like I said, I was raised by my mom and my grandparents, and my mom was the oldest of 4 kids.
Okay.
And so I grew up in the household, and she had me when she was fairly young, about 20 years old.
Okay.
So I grew up with some of her younger siblings in the house. So it's kind of like I was my grandparents' 5th child and my mom's only child at the same time.
Okay. How do you feel like that affected you growing up and going into your career now?
Well, I mean, it kind of gave me the dual nature. I was simultaneously an only child and the baby, so I had some experience, kind of like siblings, but still had some of the experience of only child. So I got to kind of see both perspectives, which I think is pretty useful because the order of birth and the family dynamics and relationships are just so important in people's lives, and so getting to see multiple types of aspects of that, I think, has been helpful to me.
Okay. Yes, sir. That sounds very interesting. Me, myself, I was raised with my mom, and I have a lot of siblings as well. So, and I was a baby for the majority of my life, so I definitely understand how it feels to be a baby. So, doctor, you've been practicing for a very long time. How did this come about? Did you, as a child, always dream of being a doctor, or did you always dream of being who you are today?
Not at all. Very far from it.
Okay.
So my family business was doing construction work.
Okay.
My great-grandparents came over from Hungary through Ellis Island, literal peasants. My great-grandfather was a farmer, and great-grandmother was a maid. And so they came over, started a farm. They had, in Ohio, actually, they had 12 kids, of which my grandfather was the youngest.
Okay.
And then when he got older and decided he wanted to be more independent, because as the baby of 12 kids, the older ones in the family construction business up there, they didn't let him do much of anything because he was the baby. And so he brought the family down to North Carolina. And so he started his own construction company down here. And so prior to being a physician, I've only had 2 jobs other than being a physician.
Okay.
One was growing up working for the family construction company. And that was manual labor down in the ditches with a shovel in North Carolina summers, which was not super pleasant. And then the other actually was for 2 years while I was doing my psychiatry residency training, doing 80 plus hours a week. And they pay residents very little, so I had to get a second job to make ends meet.
Okay.
And it was actually for an Apple store for 2 years that I worked at two different Apple stores, one in Raleigh, North Carolina, one in Durham, North Carolina, each for about a year to help ends meet. So those are my work experiences prior to becoming a physician.
Yes, sir. So beyond being a mental health advocate, we do have working at Apple in common. Work for Apple now, love it. That's how me and you met. Had a great conversation with you, which led, to us doing this interview today. I'm very excited.
Yeah, well, to continue follow up on your question, did I always dream of being a doctor? Not at all. Coming from that kind of working class background, we didn't have any doctors in the family.
Yeah.
Didn't really have any college graduates even in the family. But I really loved to learn and education. My grandmother was a teacher, and she was my inspiration to want to become an educator.
Okay.
So I thought I love science. I love teaching. So I'll go on to college. She can get a PhD, and then I'll teach science, some sort of science, chemistry, physics, biology, mathematics, something like that. And then when I got to college, I realized that professors only teach about 2, maybe 3 hours a week.
Yeah.
And the rest of the time they're writing grants or doing research and all this stuff that I didn't really find much interest in. And so I had a kind of a crisis of, what do I do with the rest of my life? If I'm not going to do what I'd always thought I was going to do, what am I going to do? And I was a chemistry major, so I had taken all the physics and calculus and organic chemistry and all the classes with a lot of pre-med students. And so I started to think, well, in my end of my sophomore year of college, what if I became a doctor? What would that be like? And I really had no idea. So I'd always done a lot of volunteering because being of service is very important to me. So I just switched over from doing volunteering, teaching kids to read or whatever it would be, to working or doing volunteer work at the hospital at the university. And so I would talk with medical students, doctors, things like that, and read books on what it would be like. And I thought, this is perfect.
Yeah.
Because as a physician, you get to teach every patient every day about their illnesses, about their medications. It has the lifelong learning that was always important to me, and also being of service to others. So that's how I decided to become a physician.
No, that's incredible. Just how you thought that, and I think that was your purpose in life. I think everyone has a purpose, and I think you found your purpose just by doing all the volunteering work, and then seeing that, hey, I'm in the same classes as these people, but I want to do something completely different. Why is that? And then you start to dive deeper into things like that and start volunteering elsewhere, so you can find, once again, your purpose. The title of the podcast is Accidental Isolation. I do believe that everyone has one or many of those, and even if it's only one, how many times does it happen, right? So I want to ask you that question. Accidental isolation is a moment where you may have not felt it during it, but it's a moment where you may have isolated yourself, whether it's that physically, mentally, or emotionally. Tell us about a moment in your life where you may have felt isolated.
So it was kind of a cascading series of isolations.
A couple of them.
So when I graduated college, I chose to go to medical school in New York City.
And which school did you graduate?
So I went to my undergraduate degree was from Duke, and so from Duke I went on to New York University for medical school.
Okay.
I just felt this pull that I felt like I had to go to New York City for some reason, and so I left all my family behind and moved up to New York City. Didn't know anybody. And my first week of medical school was the September 11th, 2001 attacks on New York City. And so here I was in a city I'd never been in before, didn't know anyone at all, and the attacks happened. And when they happened, at first, like a lot of people, we thought that it was just an air traffic accident when the first tower was hit and fell, and we went about our classes, and then we moved on to the anatomy lab, and then we heard that the second tower was hit, and then we knew it wasn't just an air traffic accident. This was intentional. And this was, in 2001, that was before the days of everyone having easy access to internet resources, and phone lines were completely jammed because everyone was trying to call everybody. So there was no way to get really good information. So all of us, our first year of medical school, first week of medical school, we didn't know anything, but we all put on our scrubs and went a couple blocks down to the Bellevue Hospital emergency room because we wanted to help. And I think every off-duty doctor in Manhattan showed up there, so they told us, kids, go away, you're in the way here. If you want to help, go donate blood. Yeah. So we tried to go donate blood, but the line to donate blood was, 10 city blocks long, something like that. They said, there's no way we're going to get everyone in. Maybe you can come back tomorrow. And walking down the street by myself, I would just hear people saying things like, another plane just hit the Washington Monument now. There's people with Uzis on Fifth Avenue. And it was, none of that was true, but we had no way of verifying that. Couldn't call home because phone lines were jammed, everything like that. And the dorm room that I had windows that looked out, and it was right by the Empire State Building, which would have been another prime target. And if a plane had hit the Empire State Building, I mean, and it would have gone down, shrapnel could have flown through the window, and so I just really just hid behind my bed and cried. And after that, I started having panic attacks for the first time. I'd always had a lot of generalized anxiety, but never had panic attacks. I started having regular panic attacks after that. And so that actually led me to the school psychiatrist. And I started seeing a psychiatrist and some weekly for the next couple years of medical school. And that was part of what led me to realize that psychiatry was the right career for me. Because even when I got to medical school, I didn't know what specialty physician I wanted to be whatsoever. And it turned out a confluence thing. It wasn't just that. Looking back, it was something that I'd always kind of been working towards. Always loved hearing other people's stories, figuring out what makes them tick. My favorite class in retrospect in college was the intro psychology course that I took just to meet a prerequisite. Things like that, where I realized, wow, I've been working towards psychiatry my whole life. But that was kind of when it crystallized for me, and I realized that I want to be the person on the other side of the chair. And this is how I want to use all that training and all that education and to be able to help people. So by reaching out and asking for help, it helped me to realize that that's how I could best be of service helping others.
So I have a few follow-up questions diving into that. One, how long were you in New York? So I know this was your first week of school. How long were you in the city of New York at this time when 9/11 happened?
Not long, because we don't get there much before when it actually starts.
And I was asking because when you're hearing these stories about, you see the towers go down, there's no lines of communication, there's no social media, right? And you hear these stories about what's going on blocks away and things like that. What are you feeling? I know eventually you end up getting to your dorm room. You get up there and you see, that the Empire's right next door. What are you going through in your head?
It was just sheer terror. Because from walking a few blocks back to the dorm, and if Fifth Avenue is not that far away from where I was on First Avenue, so if there's, as I mistakenly thought at the time, if there were people with machine guns, Uzis on Fifth Avenue, well, maybe they're on the way to First Avenue. So just kind of terror getting back there. And then in the aftermath of that, if you ever saw the TV from the aftermath of 9/11, where they had the morgue trailers and the long lines of people lined up with pictures of relatives, have you seen this person? That was my medical school. And so even in the aftermath of that, I would have to get to class, I would have to walk through those lines of grieving people, hoping that maybe that their loved one was going to be found in the wreckage alive, hopefully. So it was it was all very numbing. And we got, I think if I remember right, I think 9/11 was a Tuesday, and that following Friday was scheduled to be our first block of exams. And
ironically,
they decided to hold them instead of cancel them.
Thankfully.
But nobody was thinking about that. And being my first exams of medical school, I failed it miserably, and that kind of really played into an imposter syndrome that I had at the time. That I felt like I'm not smart enough to be here. I'm just this kid from a working class background. I should have known that I wouldn't be able to make it. And here I had similar thoughts when I stepped up from high school to college at Duke. It's like, oh my God, you could ask my mom out front on the way out that I would tell her repeatedly, I'm the stupidest person at Duke. I can't believe they let me in here. And so that came up again in medical school. But at least I didn't fail anything once I got to college. Actually failing all of my first set of exams, and very badly. I mean, somewhere around like 50% or so of the students in the class failed. So it wasn't like I was the only one, because, like I said, who could think about schoolwork at that time? But to me, it just really hit that nerve of I knew it. And so it was just a really, really bad time for me.
Yes. Before all this happened, right? I know for myself, I went to school and I studied psychology and things like that. but I couldn't sit and say I was aware of my anxieties. I was aware of any other mental issues that I was dealing with. I wasn't aware of it until later on in my life. I realized, hey, when I was going through this is what I was really feeling. I just didn't know a name to the title. So before all these things happened, you said that you knew you had anxieties, and then at this moment you started having actual panic attacks. Were you aware of psychiatrists or therapists and things like that? Like, obviously you were aware of it, but were you one for them? Were you like, no, I'm never going to go see them? Or were you for them, you just never thought you needed them until this moment happened?
Well, so actually in college, right? So if you know Duke, there's the famous Duke Chapel. That's kind of the crown jewel centerpiece of campus.
Mm-hmm.
And right to the building to the left of it is a building that houses a number of things, but one of them is what we call a Duke CAPS, the Counseling and Psychological Services.
Okay.
And so it's really on the main quad that you go through every single day. You can't help but go past it. And there were so many times that I just stood outside the building looking up, because it was on the second floor at the CAPS building, and thought I should go in and talk to somebody.
Mm-hmm.
And every time, some other kind of voice in my head, metaphorically, would say, "Nah, you got this. You can do this. You just pull yourself up by your bootstraps. It'll be all right. You know, why would you need something like that?" And I talked myself out of it. And in hindsight, I wish I had one of those times gone in and started it then. And it really took many years. And even when I started having the panic attacks, I didn't know what they were.
Mm-hmm.
I was actually in the study hall. There's a super quiet study hall at my med school that one of the other classmates came up to me and said, "Craig, why are you breathing so hard?" I'm like, "What are you talking about?" It's like, "I could hear you breathing from across the room," because I had started to hyperventilate with the panic attack. I had no idea. I didn't notice it. I didn't know what to look for, because I had never had any kind of education or training or anything at that point on it, and I had no awareness of it either. I wasn't in touch with my body and what the signs were physically that can manifest from anxiety. So I'd known that I was anxious a lot, but I didn't know anything about it.
Or why it was.
Exactly, or why.
I think a lot of people are like this, hence why I kind of want to bring a platform like this and talk to anyone. I'm thankful and grateful that you are a doctor, right? And that's why it's important to have you on the show, so you'll be able to give more medical insight. But the show in general has people of all walks in life, because it's common with everyone.
Oh, yeah.
And that's why I want to diversify the podcast episodes and the guests I have on here, to show people that everyone deals with these things.
Absolutely.
And just like you, who is a psychiatrist, you didn't always know about these things. A lot of people out there don't know, especially as men in general, right?
Absolutely.
And I can imagine you're coming from a working background. You're everyone's in construction. Everyone's blue collar. We don't have time to talk about our feelings. What are those, right? Or we don't even know about our feelings. A lot of times, probably our adults in our lives, they don't know. So it's like, it's just learned behavior. It's not like they're intentionally telling you don't care about the feelings. Sometimes they don't even know how to speak about them.
Oh, yeah.
And like I said, especially as men, even sometimes we know that emotions are maybe good to talk about, but we have no time to do that. We have to buckle up by our bootstraps. We have to get to work. Like you said, you had the imposter syndrome. You're already thinking, I'm not good enough, right? So you're already beating yourself up. On top of that, you're standing in front of the resources you do have that a lot of people don't have, and you're telling yourself, I don't need it. I can do it. I've been doing it, so far this, in my life, and I don't need it. And that's something that a lot of people oftentimes do. Me, myself specifically, I recently started therapy, but for so long, even after studying it, not to say I didn't believe in it, I just thought I didn't need it. Yeah. I've been tough enough, I've been strong enough to fight through certain things this far. Why do I need it now? And much like you, once I started, I realized I'm still strong, but geez, I need this, right? And that's why I want to just broadcast this out to the many. Like, hey, doing these things, taking care of yourself, because that's what we're doing, isn't a sign of weakness. It's actually a sign of strength, because we want to be stronger with who we already are.
Yeah, I mean, if someone breaks their arm or if their appendix bursts or whatever, no one would say, "Oh, don't be weak and go and see somebody about it. Just buck up," things like that. And that's unfortunately, though, those are the type of mentalities that do seem to manifest with the stigma of mental health conditions. And to me, it makes no sense now. Because the brain is just another organ, exactly. Like the appendix or the pancreas with diabetes, or the lungs with asthma, or the heart disease, whatever. Those are all organs, and the brain is just an organ. And when you have a problem with an organ in your body, you go and see somebody about it and get some help, because that's what it's there for. And there's no difference between having a disorder or condition that affects the brain than of the pancreas, heart, lungs, kidneys, what have you.
Yes, sir. So we spoke about a little about how, so after the after effects from 9/11, you have to walk every day through the grieving people, and so I was only 3 years old, but obviously I've heard stories. My mother's from up north, so she had family up there, and you hear all the stories about how this didn't end a week later or 2 weeks later.
Nope.
And then you also mentioned how you kind of had a cascading of isolations. Let's talk a little bit more about that and what those looked like, especially starting in 9/11. So that's the outside. That's what's going on around you. But you also are in med school, which you don't believe you belong, especially after failing the first set of exams. You don't believe you belong. And then on top of that, all these outside things are going on. So what were some of these cascading moments during this time of isolation?
Well, what I was referring to with that was that I had put myself geographically isolated, and then with the specific 9/11 incident, just feeling even more isolated. That instead of going and starting a new school and going out and meeting people, we were all in crisis mode. That everybody was just kind of locked into, if half the class failed, then they're going to be also getting tutors and stuff. Like I met with the dean and everything, and they assigned me a tutor to work through and to help get back on track. And so everyone's kind of focused and locked in and dialed into just trying to survive
at this point.
Instead of making friends, we're all just, okay, we need to get back on track because this train is going and it's not stopping, so we've got to get on with this. So it kind of prolonged that isolation of, I'm in a city with 9 million people and I have no one to talk to.
So like in the first season, one of the big topics was community, right? People need community, whether that's family, friends, therapists, whatever that can be, and that's something that was stripped away from you. One, because of the events that had happened, and two, now everyone's focused on themselves because they're trying to survive. You're in the survivalist mindset. How did having that lack of community affect you? Obviously, you weren't, you're physically isolated. You're in a city, state, completely far away from home, as well as you don't know anyone. So how do you think that may have affected you in the long term as far as moving forward through the isolation?
Gosh, I'm trying to remember back. A lot of it is just kind of a blur, honestly. It was almost 22 years ago, and it was such an intense time. But I mean, I know that at some point I pulled out of it and went on to make a lot of friends and to find great meaning. But I don't really remember how it happened. It just you keep putting one foot in front of the other, and I think that's what happens for a lot of people that are in crisis and isolated, and you just keep going. And if you keep going, then you have a shot at getting. It's like the saying: if you're going through hell, well, keep going.
Yeah, don't stop.
Don't just stop. Yeah, so that's kind of what I did. Was I just kept going day after day, and eventually things got better.
So, like you said, I know it was a long time ago. Is there anything that you remember in particular that helped you put that foot in front of the other?
Well, going to see the psychiatrist and starting weekly therapy.
Okay. And what are some of the things that, like I said, it might be hard to remember. What are some of the things that you guys may have spoken about that got you to go to the next day and then the next day and the next day?
Well, so, we did weekly, hourly therapy sessions, and then also I was started on some medication at the time. And
knowing you got help from someone.
Yeah, that I had someone that I was going to talk to for an hour every week who was there to support me and not judge me and to help me. And that was kind of my touchstone of, okay, well, I'm struggling right now, but I'm going to see my psychiatrist in 4 days or whatever it would be. And so, I'll make it.
Yeah. Okay.
And of course, I had family support. I could, once, after that first day, could call and talk to them, and friends from college and things like that. So I was able to put it together.
From your knowledge, could you, by any chance, remember how, or do you know? Sorry. After the first day, obviously, phone lines were blocked up. After you were able to get in contact with your mother, do you remember if she noticed, like, hey, something's wrong? I know you said going through high school to college, you kind of would tell her, Mom, who am I? Why am I here? I don't belong here. And then, hey, I actually passed college. I graduated from Duke and I went on to med school. So mothers specifically are always there for us.
Especially my mom, she still is 15 feet away.
I was talking to her out there. I had to let her know that I appreciate it. Because I said mothers are always there. They're always there. Did you sense that she knew something was wrong? Obviously, with the outside effect of 9/11 happening. But could you remember her sensing like something's wrong with my son when you would speak home with her? Because I know.
I told her.
Yeah. Okay. That's even better. You knew to communicate. Because I know, for example, my mom. I can call her. And I'm not the best at communicating sometimes because I still trying to just fight through it. But if she can sense, she'll hear it. She can hear it in my tone of voice. Your mom, beyond telling her, do you think she would have known regardless?
Oh yeah, I mean, moms are always so tuned in to what's going on. I mean, moms almost physically have an eye in the back of their head. They see everything. Yeah. You can't hide anything from your mom.
Yes. So you've been practicing for how long again?
So I finished my training in 2009, so been out of training about 13 years.
Okay. So finishing NYU, obviously after the first year was pretty rough, and then you continue to go through. Just talk about some of the things you've learned through schooling, and then maybe a few things during the 13 years of practice, like some of the things you've learned and some of the things that may have changed, because it has been a time in there and the brain hasn't changed, but there's become new practices or new resources that has risen in that time being. So I want to ask just a few things about, like, what are some of the biggest things you may have learned through school about mental health, to help mental health?
Oh my gosh! I mean, I don't know how it would be narrowed down. Med school was 2001 to 2005, and then 2005, med school is all general training. Okay. Every physician gets the same medical school, whether you're a psychiatrist, a surgeon, pediatrician, cardiologist, whatever. Okay. And then you go after you graduate medical school, and then you do your specialty training. So then that was another 4 years of of specialty psychiatry training. And for that, I came back to Duke and did my specialty training at Duke from 2005 to 2009. And then 2009 to the present, 13 and a half years in practice. But I mean, there have been a lot of advances in neuroscience and trying to understand how the brain works. I mean, we're still just barely scratching the surface because the brain is, well, for one, it's harder to access than any other organ. The brain is surrounded completely by your skull, so you can't get into it while someone's living very often, except under extreme circumstances, whereas you can do a lot of other studies on other organs. Heart transplants, they can hold a heart in their hand and have it beating and put it in. But brain, you can't do that. And so it's very hard to understand. And then it's far more complicated. There's trillions of neurons working together in some harmony somehow. I mean, compare that to, the heart, that's just a glorified pump. The kidneys, that's just basically a supersized coffee filter or something like that. But the brain is just so much more complicated than anything else in the body that we know still so very little about it.
What are some of the common things you see people coming in for?
Well, so in terms of conditions, I see everything under the sun. I mean, from schizophrenia to anxiety, depression, ADHD, dementia, narcolepsy, Parkinson's disease. So,
See them all.
really everything. But really, one kind of unifying thread is that it seems like no one comes in until they're hanging on by a thread, until they're one step away from the edge, and that's what I think is such a sad thing. But that's what happened with me as well, and is that we need to start asking for help before we get to the end of our rope, because you don't have to be at the sickest of the sick and one step away from some sort of catastrophe to get mental health help. And that's what I really wish people would do, is come in sooner. Mm-hmm. When you start to notice that, hey, something's not right, and that's when it's a good idea to start the process.
But what do you think is a way that we can advocate more, or try to get people to be seen or go talk to someone before they're at the edge? Because obviously when you're at the edge, it's a lot, not impossible, but it's a lot more difficult. For one, you as the psychiatrist, and two, for the person themselves. Like, it's a lot more work we have to do to pull you back from the edge. Whereas if you're before the edge, it's a lot. We have some cushion in there. So what do you think is something that would help people maybe come in sooner?
Well, I think thinking of mental health conditions just as brain disorders. People don't only go to the doctor, they don't only get seen for heart problems when they're actually having a heart attack or a stroke. If they're starting to have chest pain or shortness of breath, they might go see a doctor, because there's no shame about that in the same way. So thinking of it the same way, really, that's the key, is just thinking of mental health as physical health. Mental health is physical health.
Yes. Okay. Now, that's very important. Once again, the reason that this platform here is just to bring light to it. I think one of the biggest things that's happening now is a culture shift, and I think it's for the better. Coming out of COVID, right, which isn't anything like 9/11, but it's a major event the whole world went through, right? And coming out of that, you have a lot more people aware of depressions, anxieties, and things of that nature. You see the shift. There's a lot more people talking about mental health, which is great. I think that's a way to bring more light to it and bring less shame to it. Like, hey, this is normal. Everyone's going through these things, right? And it's very common. So
and one thing that I get asked all the time about people, did you see a lot of people coming in because of COVID? And meaning that people who developed new depression or new anxiety due to COVID. I said, not really. What I did see a lot more people during COVID, but it was people who should have come in a year ago, 5 years ago, 10 years ago, and it's just that now they're coming in saying, "Oh, I'm coming in because of COVID." It wasn't because of COVID. It was just that they finally felt they had a socially acceptable reason to come in. No one could be ashamed of coming in because everyone's anxious and everyone's feeling down or depressed because of COVID. Well, if that's what you need to get in the door, hey, I'm fine with that. Just get in the door.
Yeah, you're here. I didn't think about it.
You're here now.
I never thought about it that way, because it's honest, it's the truth, because even for myself, it was like a lot of people grew social anxiety because you were inside. So when they come back out, a lot of people still don't really want to be outside a lot. But when we are out, we forgot how to speak to people sometimes. We don't know what to say. We don't know how to say it. We don't want to step on anyone's toes or anything, even with the social injustices going on around here.
And then there's the dance of, do you handshake, do you fist bump, do you do elbow, and you don't know what to do.
Exactly. But like you said, it's like they use the social anxiety as an excuse. But like, like you said already, they've needed to come in beforehand. And now
almost always.
And now it's more socially acceptable. No, that's pretty cool, because like you said, it has such a negative connotation to it, that people don't want to be involved with it, or they don't want to be the guy that sees the strength, or they don't want to be that person. And now they're able to, which is, like you said, it's good. That's what gets you in the door, because at the end of the day, we need you in the door. So what are some things that you would what's some advice you would give to people?
Sure. So some general advice, one thing would be that just be mindful of your body. Like I mentioned, I didn't realize that I was breathing really hard, my heart was racing, things like that shakiness, sweaty palms, the dry mouth, those can be symptoms of anxiety. And so just kind of pay attention to what your body's telling you, because your body can tell you a lot about how you're your mental and emotional statuses, and just being mindful of yourself and your body can be really helpful of trying to figure out where you're at emotionally. Another one would be is what I say to every patient I've ever seen is sleep is the foundation of mental health. Without a good foundation, your whole house is going to crumble. So whatever it is, whatever mental health condition, diagnosed or not, work on getting better sleep. So cutting out caffeine, especially later in the day, setting good bedtimes, don't have screens right in front of your face right before you try to go to bed, things like that, and having set bedtimes and wake up times consistently. We call that sleep hygiene of things you should do to make sure that you're putting yourself in a good position to sleep, because sleep is going to help literally any mental health condition under the sun. That's another one that applies to everybody. And just reaching out to someone, whether it's a friend, family member, a primary care provider, a nurse, a therapist, a social worker, a physician, a psychiatrist. Just talk to somebody about it. Get a second opinion, so to speak. It's kind of like a reality check. Like, hey, I'm thinking X, Y, and Z. How does that sound to you? And that can help you to figure out, okay, is this something that I'm thinking, that I'm worried about, afraid about? Is it reasonable? If other people think it's reasonable, maybe it's okay. But if you start to talk about it and like, whoa, you are way too much in your head about this, you've got to, you really should go see somebody. Just try to reality test of, are these fears, concerns that you have, are they something that you really should be worried about, or something you should work on not being worried about? That would probably be another one.
All right. Well, once again, I want to definitely thank you. I really appreciate you giving me a little bit of time, and I hope the viewers and the listeners be able to gather a lot just from your story alone, as well as some of the tools you gave to us at the end. So I really thank you and appreciate you coming on.
My pleasure. Thanks so much for having me.